So we're gonna talk about prescription drug abuse, and I named this topic, but my doctor prescribed it for me. Again, I already introduced myself, April Larsen with Classic Lifeguard. So let's talk about the prescription drug overdose epidemic, okay? Do you guys think there's a prescription drug overdose epidemic in New Mexico? Absolutely, okay? Not only in New Mexico, all across the country. Just some states are unfortunate that it's a bigger epidemic than others. So we're gonna watch this first little video here.
American health tonight, and pills and painkillers, a hidden epidemic striking our neighbors and our families. A new alert tonight from the CDC says the number of women dying from overdoses in America is skyrocketing. More women die from overdoses on all drugs than die from car accidents. And a new member of our ABC News team, investigative reporter Aditi Roy, spent today asking why.
Started with just 2 pain pills a day, relief from the chronic pain of Crohn's disease. Within months, she was up to 70 to 80 pills a day.
It just kind of spun out of control without me even realizing what happened.
Today, that new government report revealed a woman is admitted to the ER for a prescription pill overdose every 3 minutes. What's more, the number of women dying from prescription pill overdoses jumped 400% between 1999 and 2010. And across the country, women called in to share their struggles with addiction.
I was very good at hiding it for a long time. I was very manipulative in my entire life, my whole day. My days were not normal unless I took my medication. How could I be addicted? You're prescribing this stuff to me.
Doctors tell us women are more likely to suffer from painful conditions like fibromyalgia and migraines, often treated by prescription pain pills. Why are women more likely than men to become addicted to prescription painkillers?
Well, women tend to be prescribed prescription pain medications more commonly than men. Also, women tend to be smaller in size, so the dose is actually larger for women who are smaller in size.
Women are also more likely to consult doctors for pain, and the CDC says are more likely to go doctor shopping, getting prescriptions from multiple providers. Nagin told us she saw her primary doctor and then 4 others on the side.
One doctor was like 90 years old and he was writing me a prescription a week and he didn't even realize it.
This is staggering news, Aditi. So what are we supposed to do with it? What's next? What can be done?
All right.
Doctors we talked to, Diane.
So it is an issue. The epidemic is that the U.S. prescription overdose surpassed 17,000 in 2010. In the counties that are surrounding this area, the deaths from prescription drug abuse increased by 66.3%. That is a huge increase of the overdoses and deaths that we see in the surrounding area. 100 deaths a day are attributed to prescription drug abuse. If we had a plane crash every single day killing 100 people, oh my gosh, there'd be people yelling and screaming. Would there not be? Fix this. Something is wrong with this system. You wouldn't fly. Would you fly on a plane if 100 people died a day? But yet we have no problem filling a full prescription of Allure tabs or Oxycontins, and we have no problem with having a physician prescribe it. In fact, if he didn't prescribe it, we'd probably complain about him, that he was barbaric. All right, so in one of the level 1 trauma centers EDs, we were getting just like rashes and rashes of people who had knee surgery, back surgery. One guy, he was in the middle of his sandwich, actually eating his sandwich, when he took, on accident, too many painkillers that were prescribed. He had a combination, and he fell asleep with the sandwich in his mouth, and he's just lucky that his wife came home at that time. His respirations were only 2 or 3. We had to resuscitate him, and he's lucky to be alive today, okay? Just a huge amount of rashes of these types of things that we're seeing in the ERs, and this is all around. This is not an urban thing. This is not a rural thing. It is across the board, all spectrums of types of people. So another thing is the rise in popularity, okay? We have a lot of actors, actresses who overdose on these medications all the time, who people see as figures, and you know, teenagers, young adults look at these. Well, if Michael Jackson can take ketamine to go to sleep, you know, and he has somebody, then I can take this much amount of, you know, Ambien to go to sleep, for instance, those kinds of things. And so it really does, what's popular and out there, the trend starts to follow. So as we can see with the deaths of, from motor vehicle accidents have been going down. We have programs wear your seatbelt, zero driving, texting and driving, those kinds of things. But we don't see, well, we're now seeing a little bit more, but for a long time we didn't see a whole lot of things about medication and the fact of overdosing. And then if you look at this right here, the drugs such as heroin and cocaine have really kind of mellowed off compared to what the opioids are from prescription drug abuse. They have just really skyrocketed. So which drugs are the major offenders? And when we're talking about drugs that make you stop breathing, that reduce breathing, it's anything that's a Loratab, hydrocodone, methadone, Oxycontin, any kinds of those are ones that will actually reduce your drive to take a breath. And that is what's killing people. Some of the long-term uses from these kinds of medications is people have difficulty concentrating, you know, they combine it with alcohol, they use other medications to sleep, and it's the combination of the sedatives and the hypnotic medications. And when we're talking about sedative and hypnotic medications and not combining them, we're talking about Xanax, Ativan, Valium, Klonopin, okay? We even got Rohypnol up there. Lunesta, Ambien. Has anybody known anybody who takes an Ambien and does crazy stuff? Okay. One of the nurses that I work with, she actually drove her car 2 hours after being on Ambien, had no recollection, and was found like, you know, 2 hours away the next day at a casino, which is pretty hard in Utah to get to a casino. You got to really try hard to get to a casino in Utah. And so what about looking at signs of abuse on somebody with narcotics or opioids? So pinpoint pupil, sluggishness, shallow breathing, suppressed cough, slow pulse, low blood pressure, okay? They have, and then sometimes we have patients who are going through withdrawal. They've run out of that prescription medication and their doctor's not going to give them a refill. They've got flu-like symptoms, muscle cramps, dilated pupils, coughing, high blood pressure, rapid pulse. These people look miserable, okay? One good friend of mine was in a very horrible accident, and he said out of all the pain, out of the broken back, the broken legs, everything, the worst thing for him was getting off the pain medicine, was the hardest thing he's ever had to do, rolling around on the floor in so much pain, and the pain was from the withdrawal. So it's a serious symptom and serious things that happen when people are having withdrawals from this medications. And then signs of an overdose, shallow and slow breathing, clammy skin, convulsions, possible death. And then let's talk about how people really get to the point where they need this medication. You build up a tolerance to this medication, okay? Every day you needed, at bedtime, because of, let's say, back pain, you needed 1 Loratab. Well, in 2 months, you need 2 Loratab. And that's still not cutting it. In 3 months, you need 3 Loratab. Well, guess what? That 3 Loratab, that may get you to the point where you're going to stop breathing. So we often talk about how 1 pill can kill you, how 1 pill can be the end of your life. And taking a large single dose can cause severe respiratory depression. Typically, opioids should not be taken with alcohol, antihistamines, barbiturates, benzos are such as Ativan, Valium, Versed. They can lead to you to stop breathing because it's a combination of those medications. Those 2 medications coming together is what is causing a lethal reaction. All right, So this is Emily, and Emily was 18 years old, and what she did is she consumed OxyContin that had been prescribed by a relative. She was not an experienced drug user. She did not take hardly any drugs. This was a one-time experience. Emily died. 18 years old, died. Okay? So drug overdoses are the leading cause of unintentional injury death in America. 38,329 people in 2010 died from overdoses versus only 32,000 from motor vehicle accidents. Okay? Opioids are usually the painkiller of choice that kill people. And there is definitely a relationship of the sale of opioids, painkillers, and the overdose rate. All right, so really, what have we learned about this issue? We've learned that $72.5 billion in annual health care costs go to people who have overdosed. Abusers generate annual direct health care costs at 8.7 times higher than the non-abuser. More male than female, more in the suburbs versus rural and urban. Usually the age is 45 to 54 of the highest rate of abuse, and overrepresentation of white, lower income, and Medicaid patients. Markers include multiple prescriptions, multiple prescribers, and daily dosages. So again, we've got Robbie here, and he was taking methadone. He got a methadone toxicity. It was his first dose of that drug to prescribe to him as pain, and after that first dose, he was dead. All right, and as we can see, as more prescribers and the opioid sales go up, the more deaths and treatment admissions we see with that. So why is it happening? Why do we have all of this increased amount of opioids? The first is an increased supply, all right? The American Medical Association said that we're not treating pain enough. People are in pain, we're not treating it enough. You guys need to treat pain better, okay? So that was the first thing. So we started prescribing more pain pills. And then JACO, which is the accrediting body at hospitals, said, you're not treating pain enough. You gotta treat it better. So again, pain should be the fifth vital sign. And then about the same time, OxyContin came on the market and was extensively marketed by one of the pharmaceutical companies, which added to that as well. And then new regulations are going into effect that say, we will reimburse you the stay of the hospital or the ER admission according to what your patient satisfaction is. So if your patient had a low satisfaction in the ER, your reimbursement will not be as high. Well, that's great on some things, and on other things, you know, you're gonna have a percentage of people where the only reason they came to the ER is to get more drugs, right? But in order for them to put a higher score on that, to rate that facility as giving excellent care, comes with giving them a prescription of whatever they wanted. All right, so the opioids are complex medicines. There is, on top of that, there's a lot of social issues and public health issues related to why there is such an issue. I mean, we have moms out there who are so busy, so tired, so run down that they need something to relax. So we're seeing moms who would say, would I ever drink tons of alcohol? No, they would never. But they have no problem with popping a pill. And especially if it's prescribed. If your doctor says, you can take this, then, oh, it's very safe, we'll take that. So, again, this is Patrick. Patrick died after just one OxyContin. He had no other drugs in his system and a little bit of alcohol. He was a graduate from SDSU, and unfortunately, he made that tragic mistake of taking some OxyContin. So kind of just to see the diagram about how it works, how medications get prescribed, different kinds of medications. There's money in everything, right? Money makes the world go round. So a pharmaceutical has a great new drug. They're going to push that drug to physicians. Physicians are going to prescribe that to their patients. Patients are going to be addicted. And it's just an ongoing cycle, okay? And then you have the high school kids are like, oh, if we crush this up, we get an immediate high from this medication, and then that medication becomes very popular. They just came out with a new medication a little while ago. It was 10 times stronger than Dilaudid. If anybody knows what Dilaudid is, a very strong pain medicine. And certain states said, we will not allow this to be sold in our states. This is too powerful, too strong. We won't allow it. All right, so as we're looking here, we want to look at the death rates over the United States. Who has the highest and where do we sit? And unfortunately, in this state, you guys get number 2. You are up there with Kentucky, New Mexico, and North Dakota. Okay, you have the second highest death rate due to overdose in the state. So New Mexico was smart. They said, what can we do to combat this? We have a problem. What can we do? And actually, New Mexico was one of the first states to adopt these legislation and these laws that say, all right, we're going to put Narcan out there, and we're going to give it to the public, and we're going to say, if somebody has an overdose of a opioid, we're going to let them give Narcan, and we're going to take it one step further. We're going to put it in, we're going to let them squirt it into their nose, and we're going to give it to family members, and we're going to say to the public, if you find somebody, if you think that this is a problem, you can give it to them, and there will be no issues with that. Okay? The other thing is that the pharmacists were going to start and really educate these people, and those that seem at high risk of overdosing, we're going to send you with this kit, and it's going to tell you about this Narcan and what it does and when you should use it. And then the last thing is that Medicaid now has started to cover Narcan. Now there's lots and lots of issues around that. Some people think, I just actually got in a debate with this, well, if we just give them Narcan, we're not fixing the underlying problem. Well, we can fix the underlying problem, but they're not breathing, so let's fix that first. So we'll fix the breathing, and then let's fix the underlying. Are there going to be patients and people who overdose, get Narcan, and overdose and get Narcan? Of course there is, okay? But they're not dying, right? And we're not having to put people and intubate people, and they're not brain dead. So those are some of the positives to that. There's also some acronyms that we like to teach called SCARE ME. So you find somebody who has overdosed, a family member, something like that, you think has that kind of issue. Try to stimulate them, shake them, hey, are you okay? Calling 911, getting their airway open, okay? Doing some rescue breaths. Evaluate the situation. Do they need some Narcan? Do you have Narcan that's in the ejectable form or up the nose? And then evaluate, did that Narcan work? Okay? And this is all in the time as 911 calling, because really the only way we're going to reduce these rates is if we teach the public, this is what you need to do if you have a family member who has this, or a friend, or so on. And then how can physicians change their behavior, right? Because it's people who are prescribing. And some of them is, there's programs out there that monitor data of how many drugs you can pull these reports. How many times has this person been given a certain medication? Only physicians and pharmacists have access to this. They can see if how many physicians are prescribing them different things. They cannot give their patients this medication, right? They can reduce the amount that they give. Do they need to prescribe 90 in 1 month? No, they can reduce that and not giving in to pressure from patients, which can be difficult at times. All right, so what can you do? Lock up your medicine cabinet, okay? That's one really important thing. Lock them up from your kids, lock them up from other people. You'd be surprised how many people out there who go to friends' house and people's houses and they're looking for your prescription drugs. They go into your bathroom. They look through your counters. They look in your cabinets. I hate to say it, but it's true. Addiction does a lot of nasty things to people, changes the people who they are. Throw away unused narcotics properly. Lots of hospitals have a disposal way. Try not to throw them down the drain. We really try to not do that or flush them because they get back into the system. Recognize those around you that may have a problem and help. Probably one of the biggest things I've ever learned is just because somebody is that amazing person that you work with and you're so awed with them, or maybe they're your mentor, when they come to find out that they've used prescription drugs, is definitely hard. But we have to recognize those in those people and that they need help. If they don't get help, they're going to kill themselves. And if you have a narcotic problem, get help. That's the main thing. Get help. It's not an optimal way to live. So Good luck. I hope nobody has that has that, but that's our little talk about women and narcotic medication. All right, questions? Okay, perfect.